Hello, I'm Dr. Mahylis. I'm an orthopedic surgeon at Franciscan Health in Olympia Fields. I've been an orthopedic surgeon for nearly 10 years, and I'm a specialist in shoulder and elbow joint replacement. And today, I'd like to take the time to talk to you about shoulder joint replacement. So the number of people living with joint pain in the arm, specifically the shoulder, is increasing every year. It's probably around 100,000 in the United States. And some of the options for relief of this joint pain include non-surgical options such as medication, therapy, and injections. But when the pain becomes significant enough due to arthritis and change of those joints, surgical options generally involve replacement of the joint, in this case most frequently a shoulder replacement. When a shoulder replacement is performed, the goal of the procedure is to remove the arthritic portions of bone on both the ball and the socket. So an incision is generally made over the front of the shoulder, and when we reach the portion of the ball and socket joint, the ball portion is replaced with a smooth metal ball that is very strong, and then attention is turned to the socket where a smooth plastic strong socket is placed. When these are performed and the replacement is completed, this allows for restoration of normal shoulder motion and eventual resolution of shoulder pain. So a good surgical candidate for a shoulder replacement is someone who's exhausted all the non-operative measures to try and relieve their pain. So effectively, they've done therapy, they've tried medications, and potentially they've tried injections, all without success. And eventually they reach a point when their pain is significant enough that it can't be managed by other means, and that would be the patient who would most benefit from surgery. So expected recovery after a shoulder replacement usually involves a hospital stay of 1 to 2 days on average. During that time, we work on initiating motion of the shoulder with the help of physical therapy. So we actually start working on gaining motion back very early. The medical condition that a patient should be in prior to surgery would be someone who has good control of their weight, as well as good control of any other medical conditions that they currently are being treated for. Some new innovations in the area of shoulder replacement involve the utilization of three-dimensional planning software to determine what each patient's specific anatomy looks like when the shoulder has become worn out and arthritic. And by taking a CAT scan and analyzing the patient's anatomy, we're able to take that image and put it into a computer program, which allows us to see the patient's shoulder in 3 dimensions. Now this allows me as a surgeon to more accurately place the replacement in an appropriate position that specifically fits each patient's anatomy so that their replacement is completely unique and different from any other person who has that replacement. The benefits of this technology allow for more accurate placement of the prosthesis, and long-term can help decrease the risk that the prosthesis wears out much sooner than it should, which allows for a patient to have a more effective recovery and hopefully long-term greater benefit from their joint replacement. For more information, please visit us at franciscanhealth.org/joint replacement.